Dr. Boond Soch. He trained on thought with a series of an episode with Dr. Sanket Mehta, who is a well-known name in the country in the field of cytoreductive and HIPEC surgery, and also president of the Society of Peritoneal Surface Surgical Oncology in India and director of SSO. Sir, now in fact, in this particular episode, we'll be talking more in terms of an ovarian cancer, which I think normally is a silent killer.
Yes.
Can you throw some light for our target audience on ovarian cancer, please?
Yes. So the ovaries are freely floating structures within the abdominal cavity, and hence they have a wide area for access and grow to very large sizes before giving any symptoms whatsoever to the patient. Ovarian cancer is the commonest cause of death from any female genital tract tumor in women. Even though cervical cancer is more in incidence, ovarian cancer causes more deaths because it is often diagnosed in the advanced stage. Nearly 70% of the patients are diagnosed in stage 3, which is why the treatment is more difficult, which is why the treatment is more prolonged, and the outcomes are not as good in ovarian cancer. What happens is these patients will only develop symptoms once they start developing things like ascites. Ascites is collection of fluid inside the abdominal cavity, so they develop distension of abdomen, or weight loss, or pain is a very late symptom, often after stage 3, and which is why the diagnosis is delayed.
Is it curable? Like there are some of the surgeries which are there, like cytoreductive and HIPEC surgery.
Yes.
Like what role they play in terms of?
So the standard treatment of ovarian cancer is called as cytoreductive surgery. As the name suggests, we do a surgery where we decrease or remove all the tumor from the abdominal cavity. Ovarian cancer is unique in that majority of the times it spreads to the peritoneum. Peritoneum is a membrane that lines the inner side of the abdominal cavity, and because ovarian cancer can spread to it like grains of sand or deposits over the peritoneum, apart from removing the ovaries and the uterus, we also need to remove the affected peritoneum, any other organ on which we find deposits like the small intestine or the large intestine or spleen or the diaphragm, and sometimes it can also spread to the lymph nodes. So we need to, as a part of the surgery, remove the lymph nodes as well. So many a times cytoreductive surgery, often called as the mother of all cancer surgeries, involves performing these multiple procedures as a part of one surgery, then reconstructing everything back so that the patient can get back to normal life, and then go for chemotherapy. If the patient has got ascites, or if the patient is not in a condition to take a major surgery, then in those patients we first give chemotherapy to decrease the extent of the disease, to get the disease under control, and then perform the surgery. And that is when HIPEC comes into the picture. HIPEC stands for hyperthermic or heated intraperitoneal, that is inside the abdominal cavity, chemotherapy, which means it's a chemotherapy bath that is given directly inside the abdominal cavity at the time of surgery for a period of 90 minutes, and the heat augments the penetration of the chemotherapy directly into the cancer cells, so that even microscopic disease which is left behind after the surgical removal is destroyed by this modality, and it prevents recurrence of disease. HIPEC is often used in conjunction with cytoreductive surgery for interval cytoreduction, which is surgery done after chemotherapy, or in cases of recurrence of ovarian cancer.
How about the lifestyle of post-surgery like it's?
Most patients come back to near normal lifestyle and live an absolutely normal and productive life after the treatment of ovarian cancer.
Any precaution, like normally as with ovarian cancer, which are concerned with target audience, like should take into consideration?
One thing which is very important is that 20% of ovarian cancers are linked to a BRCA mutation. So it's a genetic mutation that is passed on from mother to daughter and so on. And if there is a BRCA mutation positive, or if there is a family history of breast or ovarian cancer in the maternal side of the patient, we can start screening at a very early age so that we diagnose the disease at an early stage. If the family is completed, as in the patient already has children and they are BRCA mutation positive, we can do a prophylactic hysterectomy with removal of the ovaries to prevent this cancer from developing altogether. And that, I think, if we are talking about 20% of all ovarian cancers, that's a big number.
Well, thank you very much. I'm sure the target audience who are listening to you on this ttalk, Boond Soch ovarian cancer which are concerned, is very insightful. God bless you in abundance. Thank you very much. Thank you, doctor.